Good morning, Dr. Josemino and team. First off, I want to thank you, and my team wants to thank you for taking the time today out of your busy schedule to interview us and to allow us to come into your office for this interview at this time. As explained before, we will be recording this interview as we have to later present this interview to our class back at school. We're very interested in knowing about who you are, what you do. Questions will address your leading role as CEO of your own private practice. Our goal is to take the information that you share with us today and use it to enhance ourselves as we all expect to graduate this fall. We want to make sure that we are the best healthcare administrators and providers that we can be in the future. So this interview will allow us to open up, to work on different skills that we may need. And it's always good to learn more information about different providers, different CEOs. And we will be more than happy to take the information that you share with us and share with other classmates that we have who are also in this field and expecting to go into the field at the same time as us. Therefore, without further ado, please tell us a little bit about yourself.
Well, I have a dual role because not only am I the CEO, but I'm also the doctor that sees all the patients. And so sometimes it makes it difficult to be a practitioner and also an administrator. Being an administrator is something you don't learn in medical school. It's sort of an on-the-job training. Nowadays, a lot of practitioners go in with other doctors and other big groups, but I'm a solo practitioner, and I have been a solo practitioner for the last 35 years, and so I'm probably not going to change. I'm probably not going to work for everybody. So when I started out with myself and one office employee, so it was easy because it was just me and her. And then over the years it's gotten busier and busier, and now I think we have a total of 7 of us. So there's a lot of interactions that go on from day to day, and so sometimes I won't have much administrative things to do in a day because I'm just too busy seeing patients. However, I do try to get involved in day-to-day operations and billing and scheduling, answering phones, and pitching in so that I don't forget some of those things that I used to do. So being an administrator is not easy because you're dealing with all kinds of situations, not only from the people that I work with, but the patients who I deal with. And so there's issues all the time which you have to try to work out in a good, constructive way. So that's the hard part about being a CEO, is that you have to have everybody help out, and everybody's got to contribute, and everyone's got to do their job.
So you did just mention how you try to get involved with billing, answering phones and stuff. So how often do you think it's necessary to meet with the employees as a CEO?
Well, we don't have any set times that we meet with employees because this is an ongoing process, and a lot of the employees have been with me for more than 20 years. And so they understand their job, they know what they have to do. And so sometimes situations come up where we have to kind of meet impromptu right at the moment. So it's not even planned sometimes. So most of the meetings that we have are that way. If a situation arises where I have to talk with someone, then I try to talk with them on an individual basis. I find that sometimes it's easier to talk with the individuals involved separately and then assimilate everything and then try to sort out what the best solution might be. Sometimes if you have 4 or 5 people in the same room, everyone's got a different opinion. Oftentimes it can become not constructive. And so my approach is to try to approach each problem on an individual basis and then work with them. If it involves others, then I will talk with the others and get all of their opinions and then sort out what I think is the best solution.
Okay. My next question is how close are you to your staff?
Well, I think I'm pretty close with my staff. I mean, you know, we are not all that formal. You know, when we're by ourselves, I don't have them address me as doctor. They can call me by my first name because I want them to feel relaxed. You know, I've gone out of my way over the years to help employees that have situations that come up in their lives, such as funeral arrangements, helping to fix a transmission, you know, different things of that sort. They come up that are over and above, you know, what is expected from a CEO. But because I'm close with them, and because they have been good, loyal employees, I feel as though I should try to reach out and help them if they have a problem that they can't solve. So I think I'm pretty close with them.
That's really good.
So for new grads like us, it's very important to have certain skills. So what interpersonal skills do you believe would be best for us to have heading into the healthcare field?
I think that one of the best things to have would be ability to get along with everybody in any kind of situation. Although some instances you may feel very strongly one way or the other, it's good to listen to what the other person has to say, not interrupt them, and try to understand their point of view. Even though your point of view may be differently, I've found that it's easier to try to get along with people than it is to try to confront them. Sometimes when you have a situation that arises, it's easy to perhaps say some things that you may regret later. And so you never want to get in a situation like that in life, regardless if it's your work or your personal lives. You want to be in a situation where you don't have to say, I'm sorry I said that. But sometimes our tempers take off, and sometimes, you know, we shoot from the hip. And so I think it's important to try to step back from the situation, to try to get along with whoever it is you're having to deal with, so that you're able to work with them in the future. If you say something or you have something that you don't get along with someone, that could stick in your mind, and it could really set the tempo for a bad relationship and a bad workplace. So, you know, getting along, listening well, and trying to compromise are all good interpersonal skills.
Okay.
So, as we touched base earlier, interpersonal skills play a big role in our field, correct?
Interpersonal skills are half of the battle.
Yep. So my question is, can you kind of define other successful traits or skills that we should possess aside from just interpersonal skills? So I mean, like, would you say we should master things like budgeting, insurance? What skills?
All of those skills are important. Most important skills are working hard, setting a good example for your, you know, the people that you work with. That means getting there on time, getting there 5 or 10 minutes ahead of time, staying 5 or 10 minutes later, not looking at your watch, figuring, when am I out of here? So by setting an example, I think that's a very important part of mastering some of the skills. And then working with others in a positive way. So, you know, getting back to your question, I think that, you know, I think it's important to try to work with people and understand people.
Okay.
Since we touched on based on your experiences, and what you find important. I refer back to my HR class, which I found that is very important about interpersonal skills because this field is so complex and diverse. So my question is to you, how do you deal with, how important to you are interpersonal skills in dealing with diversity?
Well, that's very important because in a medical practice, not only do I have a diverse group of people that work for me, I have a diverse group of patients. And I moved here 5 years ago from one location to the other, and I saw a big difference in the diversity of the patients that I never even considered. So you have to be able to adapt and adjust. Now, diversity, I treat everybody the same way, and I think that's a good way to approach HR skills. Everyone's got to be treated the same way, regardless of their race, color, or creed. And I think they have to know this, because some groups feel as though perhaps that they're being overlooked for a job promotion, or they're being overlooked because of who they are. And so, in my mind, those are wrong things to look at. I look at a person for who they are, what they've done, what they can do, how prompt they are, how hard they work, and I use those same determinations for everybody. So if you treat everybody the same way, you really shouldn't have any problems with diversity. Everyone's got, different positions and different situations in their lives, and you try to understand where they're coming from. But basically, by treating everybody fair, listening to them, you will overcome diversity.
And then the next 2 questions are going to be for Jamila since she's not here with us.
Okay?
So, since you're the CEO and the only podiatrist here at the private practice, what made you nervous to take this solo, business on your own?
Well, it happened a long time ago, so sometimes you forget. So when you go 35 years back,
Not that
that's
old.
longer than all of you have been around. I was offered working for another doctor in another office. And so it was a gradual transition. So I was working for him, but he wasn't in the office because he was sick. And so after 4 or 5 months, he decided that he wasn't coming back to the office, and so then I was able to take over. So I made a gradual transition from working with somebody to working by myself. So I didn't have that cliff of being nervous and being anxious. I guess the most anxiety that I had was after I finished my residency. When you're a resident, you work with another doctor, and you do surgeries with another doctor. But when you're on your own, you're all by yourself. And so you think, now I got to do this all by myself. I don't want to make any mistakes. So you start out making little tiny bites, little steps. You do little small things that you feel comfortable with. And when you feel comfortable, then you move on to something more. That helps your anxiety and makes it easier so that you're not overly anxious when you start your work. Don't be overwhelmed, You can only learn so much in a day, and it takes a long time to be an administrator. It's not something you're going to learn in a week. It's a gradual process. And then, after 4 or 5 years, you say, oh, well, look at where I went. I went back and forth, and I learned all of these skills that I didn't know when I graduated, because you don't know everything when you finish school. You know that much. And then little by little, you start to learn more. And so that's how you get past those fears.